March is Colorectal Cancer Awareness Month. So the average risk is 5%. Take 20 people in a room, one of those people will be diagnosed with colon cancer. Well, colon cancer, when diagnosed early, at an early stage, is curable. Colonoscopy is the best test to actually look at the lining tissue of the colon to identify a precancerous lesion called a polyp, and if there is a cancer, to make that diagnosis. Colon cancers arise from colon polyps, but not all polyps turn into cancer. When we perform colonoscopy and we detect a polyp, we remove it. We send it out to the pathologist. He analyzes the polyp under the microscope and determines whether or not that polyp is precancerous or not. If the polyps that we removed are small and not precancerous, then generally that's the same thing as not having polyps. And patients are still considered average risk and don't need another colonoscopy for 10 years. If cancer is diagnosed, then we refer to surgery to have the tumor removed. We have 5 general surgeons in our community: Drs. Britt, Dr. Arias, Dr. Kumar, Dr. Parrish, and Dr. Medlock. All are experienced surgeons, and this is a fairly common surgery. The recommended starting age for colonoscopy is 50 years old for people at average risk. Now, the exception to that is African Americans. That was recently changed to 45 years old. I think some people are reluctant to have a colonoscopy for several reasons. They're afraid of finding out that they might have cancer, thinking that there's nothing that can be done, and that's incorrect. Other people fear the preparation, which in the past involved drinking a salty solution, which was unpleasant. We don't do that anymore. There are other options that are more palatable. The procedure itself only takes about 20 to 30 minutes. And during the procedure, the anesthesiologist provides sedation intravenously with a medicine called propofol. Colon cancers are generally a slow-growing process. And this is why colonoscopy is so beneficial, because it can diagnose a precancerous polyp and remove it and prevent that polyp from turning to cancer.